Hi, I'm Steve. I want to spend a couple of seconds of your time and tell you about the green light laser procedure I had recently with Dr. Gholami. But first I want to tell you a little of my history with Dr. Gholami. I've been seeing him for about 10 years now. I came over from my last urologist who had just retired, and at the time I was doing follow-up on kidney stones. I had had kidney stones smashed some years ago under his care, and I still had additional kidney stones. I had a few CT scans and ended up having Dr. Gholami do another kidney stone smashing and finally getting them out of my kidneys totally. And we had several normal just blood tests and stuff like that. I had several spikes in my PSAs, and I had to do a couple of tests for the prostate. And what we found was I had an enlarged prostate, but no cancers at all, so that was all good. Later on during the years, I've had times where I had bladder stones and he had to go in and fish them out. So I've had a long process of different procedures. But my most recent one was the green light procedure, where they go in and cut the prostate back a little bit to allow the urine flow. This kind of came to my attention. Well, first of all, I should say I was treating it with the medication, Flomax and Avodart. Both of them worked, and I'd take some, I'd take those little paper tests that you take where you say, how many times you get up and that kind of stuff during the night, and whether you have a weak stream or anyway. And I always came out with those tests in about the middle, and I felt like the medicine was working. But then I started to bleed when I play golf or ride my bike or anything where I would do any kind of stress, I guess you'd call it. And turns out that since my bladder wasn't clearing completely, I was building bladder stones. So this procedure went in and opened up the urethra so that I could urinate completely, and then also he had to go in and crush some of those bladder stones because they were too big to pass. So the procedure went really well. I can't tell you how, I should have done it earlier, honestly. It was no pain. Everything was like clockwork. The team here, the team at the hospital were excellent. Dr. Gholami was excellent with both me and my wife, and going over, and this is over the years, going over all our options and what we could or couldn't do, or what we should or shouldn't do. And I can't say enough about that. One of my fears, I guess, was that I'd have to have a catheter for a long period of time, 2 or 3 days after the procedure. And I spent just the overnight in the hospital. I had an afternoon procedure, and took the catheter out first thing in the morning, 6, 7 o'clock in the morning. Just had to urinate once for them to allow me to go home. Probably did that in the first 15 or 20 minutes, and I was off and home. So overall, Dr. Gholami has been really great for us and for all my procedures, and as you can tell, I've had plenty. And I can't say enough about him or his team, and also the El Camino Hospital, which used to be the I think Los Gatos Community Hospital. They were excellent over there too. So all in all, if you have this need this procedure, I wouldn't put it off. There's no pain, no. I never had to take a tablet in any kind of thing, like not even a Tylenol. It's just easy going. So that's it.